Nurses continue to be regarded as the most trusted professionals in America.
And while that has not changed, there have been many advances in nursing practice over the years.
On this week's Health Talk, we'll discuss the Pathway to Excellence, a nursing designation that one local hospital has received. So stay tuned, we're up next. Hello, I'm Dr. Vicki Smeaton.
And I'm Dr. Eric Mazer. Today we're going to talk about advances in the profession of nursing and nursing practice and a prestigious honor received by a Connecticut hospital, Norwalk Hospital. Our guests are Renee Moriello and Joe Ritchie, representing Norwalk Hospital in the nursing practice. I've worked closely with both of them over the years.
Absolutely.
Welcome to Health Talk.
Thank you for coming on the show. It's nice to have you. So what is this Pathway to Excellence? Renee, why
That's
don't you
the
tell
award,
us?
isn't it, Vicki? It's called Pathway to Excellence.
Pathway to Nursing Excellence, and it is a national designation that's awarded by the American Nurses Credentialing Center for hospitals that are demonstrate nursing excellence, as well as being a hospital where nurses really want to work, where nurses are engaged in their practice, collaborate with other professionals to provide the best patient care and the best quality of care that we can to our patients.
You must be really proud as the head of nursing to have such a prestigious designation bestowed upon the nursing staff at Norwalk.
I'm absolutely ecstatic. When I came to Norwalk 2 years ago, I saw all of the qualities of a Pathway hospital, and to get that recognition at this point is just really exciting, and the staff are ecstatic about it.
And Joe, what's your role in all of this? You're both nurses, so we'll get that out on the floor.
Yes, so I am the Pathway Program Coordinator. Essentially, I'm the individual facilitating this designation with Renee's help and a group from the Department of Nursing. So really leading the change in the application, doing the gap analysis, seeing if we are really ready for this designation.
Now this is all reflects the change in medical practice, this movement from individual doctors sort of running everything and nurses following orders to the more team approach and the importance of nursing in that team. And I think, so what are the kinds of things, and for our viewers, that nurses have to do in order to achieve this Pathway to Excellence recognition? This is a national set of standards, isn't it?
Yes.
Yes, and we have to demonstrate that the nurses are engaged in creating policy and procedure in how we deliver care. We have to be able to demonstrate that they do, and we have multiple councils that nurses, bedside nurses, leadership nurses, educational nurses, all sit together on a council, and we vote and come to a democratic kind of agreement on what direction we're going to go with nursing and how we're going to deliver the care. We also are expected to collaborate with the medical staff on teams within the hospital so that nursing has a voice in every aspect of care that's delivered.
I think that collaboration is very important, and that word collaborative, it comes up a lot in a lot of the shows we've been doing recently as healthcare has changed and the way that we deliver healthcare has changed. It's about the team approach, isn't it,
Absolutely.
Joe?
Absolutely.
Yeah.
But I think it, again, reflects this tremendous change in culture that I've lived through, and I've said this before on the show. When I was a medical student, we were told unequivocally, it's your job, you're responsible for everything from the patient, beginning to end, night and day, whether you're here or not, and you're supposed to be here most of the time.
Right.
And that was in an era where there wasn't a lot of stuff that we could do medically. But it was also an unrealistic expectation. There's so much now, there's so much complexity, there's so much complex care that needs to be delivered, and the nurses are the ones at the bedside delivering it.
Sure, and you raised a great point, because at the center of this is the patient, and Pathway to Excellence really focuses on 12 different elements. To what Renee had mentioned about collaboration and having a team approach, it's also ensuring that nurses are engaged, that they participate in decision making, that the environment we work in is safe, and that we have the properties and the processes to ensure that our patients, first and foremost, are safe and deliver high quality care.
And the interaction between nursing and physician staff in the pursuit of this pathway and implementation and whatnot has been really good, in your opinion?
Oh, our medical staff has been very supportive, and we, as I said, we work on a number of teams with them. We get lots of support. We have multidisciplinary rounds every day to assure high quality care. And we also sit on committees with the physician and other disciplines as well to make sure that we provide the best care that we can to our patients.
So we have a picture of the whole team that achieved this. Maybe we could bring that up just to show how many people were involved just from the nursing standpoint. So tell us about this picture, Renee.
Well, this was right before we got our designation. We were sitting on pins and needles. We knew that we had finished it and completed all the tasks, and we were just awaiting to hear. Our nurses had to take a survey. 75% of our nurses had to complete this survey to verify that we, in fact,
Doing what you said you did.
do what we say we do. And so we were getting ready for that, but we shot this picture a little bit before in anticipation that we were going to get the designation.
That's a great photo.
So maybe you could tell us, Joe, give some specific examples for people at home of what's discussed at a collaborative council or a nursing council, what types of decisions are made. I think people don't have a really clear idea, people outside of the profession don't have a real idea of how complicated nursing practice is and how many opportunities there are for mistakes and errors and things that can hurt patients. So tell us a little bit about what you've done and what these discussions are directed at.
Sure. So we have a number of nursing councils, if you will. So at the high end, we have the Nurse Executive Council, where the nurse directors are able to formulate a strategic plan for the entire department. Staff nurses are involved in clinical practice. They look at informatics and computers, but we also look at education and quality. And I know that's come forward with healthcare nowadays, but we do look at numbers. We do look at our infection rates, and as nurses, how can we better improve the process? And so with the nurses being at the front line, they see firsthand if there are barriers to care that our patients receive. So whether it be equipment or technique, so those are one of the things we've looked at.
I know that for, again, my own experience, things that I used to believe were just part of medical care, central line bloodstream infections. Those are infections around intravenous catheters that are put into the deep vessels of the head and neck,
Urinary
chest.
catheter infections.
Urinary catheter changes, skin care. I used to believe that a decubitus ulcer, a sick patient that was in the hospital was going to get a decubitus ulcer. That was just inevitable. And now we've learned that proper nursing practice with physician involvement can help prevent many, if not most of these. And so I think we've learned that there's a lot more nursing than just simply following orders.
And it's constantly evolving. And so what we do is make sure that we're on top of what we call evidence-based practice, which is the best practices. So we do a lot of reading and literature reviews to make sure that what we're doing is the most up-to-date practice to ensure that we don't get infections and that our patients don't incur some of these setbacks.
But really, Joe's point about the nurses being at the bedside and really getting the input from the actual nurse who's providing the care at the bedside, because we know, Eric, you and I, as physicians, we take care of the patient. We pop in the morning, we make rounds, we may pop in a few times over the course of the day, but really it's the patient's nurse who's at the bedside going in and checking on them every few minutes, who'll notice things that we don't necessarily notice.
And patients will also say things to nurses
that they won't say to their physician. Absolutely true.
I was just going to mention, it's bridging that theoretical sense with the practical sense with the nurses at the bedside. Again, they're able to see those barriers to care.
Are we seeing differences in our quality scores, in our patient satisfaction scores that you've noticed over the time that you've been here, Renee, the 2+
Absolutely.
years?
Our nursing satisfaction scores have gone up in the last 2 years, but we've also seen a significant improvement in a lot of the quality indicators, the nursing ones that Eric talked about, which central line infections, we are well below the national benchmark for all of those indicators. So it has significantly improved the way our patients receive care, and so we're very proud of that.
Urinary catheters are a big one. And again, this is an area where there is now clinical evidence to help guide our practice. And again, I can just use my own experience. most patients who came in unstable in my era got a urinary catheter that we
Right.
left in
Until
as
they
lo-
went home.
Almost until they went home,
Right.
because it was assumed that if they didn't have the catheter and were incontinent, it would lead to bed sores. It was more work for the nurses. You got a better measurement of the urine output, and we figured, well, all that it made sense to us that using urinary catheters was good. And almost everybody got an infection if you left it long enough, and we assumed that was just the inevitable side effect of this benefit. And that's been proven not to be true.
Absolutely, and we've almost decreased our catheter rate by 50%. We actually put in far less catheters. When I walk around and I'll be in the emergency room on one of the units, and I see someone going to put a catheter in, I'm like,
Do you go on catheter patrol?
Why
Not
are we
that
doing
one.
this? And so they'll usually explain why. And
Yeah.
usually patients who are critically ill or
Sure.
are going to require an extended, care, we will, there are reasons to put them in,
Yeah.
but we try
But you
not
try to
put
get them
them
out as soon as
Try to
And
possible.
get them in
catheters are
and
a
out
good
as
example
quickly as
of
possible.
nursing
Yeah.
practice, because again, as a physician, I may forget the patient has a catheter. You know,
Absolutely.
when you're rounding on 15 people, you may forget that it's there. So you may have needed it on Monday, but you may not need it.
Right.
So this has become something that's a nursing-driven protocol.
Sure.
And
that's
also,
very different.
when you talk about collaboration, we have a nursing informatics team. Now with the modern technology and informatics, how do we alert the doctor to even let them know that we've got this catheter in? So we've built in all these alerts so that people are more aware of what's happening and how important it is to get them in, get them out. And that's where our nursing informatics and the physicians work together very, very closely.
And this
to
is where
develop those
nurses
strategies.
are more empowered now to speak up, and that's something that I
Sure.
think we should
Yep.
focus on in our next segment. As we go to our commercial break, when we come back, we'll talk a little bit more about that
Right, this
and
team
patient
approach
safety.
to medicine that we've talked about on this show
Yeah.
many times, it's really changed the way we practice medicine. Much better for the patient. So I want to thank you, and you'll be back in the second segment after we take this short break. Hi, we're back with Renee Moriello and Joe Ritchie. We're talking about nursing practice, nursing excellence, the pathway to excellence, this award that the nurses at Norwalk Hospital have gotten, and how that's really changing patient care.
And how nurses are so much more empowered now than they've ever been in the profession to be collaborative and proactive. And we talked a lot about reducing infection rates and some of the quality indicators that we measure in terms of how well we're providing patient care. There's a lot of education that goes along with that, isn't there?
Well, there's a tremendous amount of education that goes along with it, and part of what the pathway also enforces is that we are always trying to enhance the skills of our nursing staff. And what has happened during this process is that we've increased the number of staff members that have specialty certifications. We've increased the number of nurses that have gone on for their baccalaureate degree by almost 30%. Master's prepared nurses, and now we have nurses enrolled in PhD and DNP programs.
And what's
So,
the DNP program?
Doctorate of Nursing Practice. So,
It's really, people do not realize the level of skills of our nurses. And you know, I can speak to it in many areas, but as an oncologist, as a former oncologist, the nurses were essential to me in caring for the patients getting chemotherapy. But today, I think back, we have nurses who are reading maternal fetal strips and monitoring patients, because the doctors aren't there every second doing that. It's the nurses that do that and alert the physician if there's a problem. We have nurses monitoring EKGs and telemonitors. We have nurses monitoring patients' mental status and pain levels. Very important things, and their decisions really drive the care.
Yeah, the decisions, and also having a questioning attitude. I think that comes up a lot in our new lingo with regard to patient safety. Maybe we can talk a tiny bit about that and have the nurse at the bedside picking up on things that maybe the physician hasn't noticed.
well, their input has been fostered and encouraged, and that's what the Pathway to Nursing Excellence environment fosters, that whole collaborative approach. It fosters a questioning and inquisitive participation on the
You mean
nurse's behalf.
the physician's not always right?
Well, sometimes they need.
Don't answer that. We're putting
The fact is, we all make mistakes.
Of course.
Sure.
Absolutely.
Or we all don't have all the information. And
Yeah, and having somebody who's at the bedside to be able to speak up and not feel intimidation or whatnot to say,
Absolutely.
you know, doctor,
Absolutely
did you
right.
really mean to order this in a way that's not challenging, but that really has the best interest of the patient
Right.
at heart.
No, that's happened to me. Again, I think back to oncology days. That you get busy, you may put a decimal point in the wrong place.
Sure.
I'm incredibly thankful for the nurses who will say, hey, did you mean to do this? I remember some specific instances where I wrote chemotherapy orders that were wrong.
Right. It's about patient
I
safety.
didn't want to hurt anybody. It wasn't that I was stupid. It wasn't that I didn't care. It was just simply we all
Absolutely.
make mistakes.
How does that translate to in terms of the nurse's role these days in terms of clinical practice? The nurse will pick up a medication error, and we should talk a little bit more about safety. I feel will pick up an error and bring it immediately to the attention of someone.
A lot of this has to do with being a high reliability organization,
Yes.
which Norwalk is also is partaking in this with a number of hospitals
Yeah,
in the
I'm very
state.
proud of Connecticut because this is a Connecticut Hospital Association initiative of Connecticut hospitals. We're the first state in the country to do this, and we've made a commitment to using practices developed in the nuclear power industry and in the military, in the aviation industry, bringing them to the bedside so that we can bring that level of safety to our patients.
That's
I
right.
think it's a spectacular initiative by the state.
And the initiative does really support nurses speaking up. You see something, say something, and it's empowered them. It's created a much safer environment because the more eyes and the more people involved, the better the care and the safety of the patient. So we're very proud of that, and I think the pathway, high reliability, it's all made for a much safer environment for our patients.
Yeah.
And medicine, it's become a dangerous place. Hospitals, we know,
Sure.
what is it, 44 to 88,000 people may die a year in hospitals because of medical error. And I hope that's lower by now. That was an estimate made, I guess, about a decade ago.
Right,
It's
and nurses are
frightening.
being vigilant to be able to, as you mentioned, speak up and recognize that the process can be improved, and turning to the literature to know what the best practice is so our patients can benefit from that.
Yeah.
I want to talk about some of the safety practices that we've put in, but first, the symbol of Pathways to Excellence. There is a graphic.
lighthouse.
We have a graphic with a lighthouse, and I
Yes.
just want to know what that is supposed to mean. It's a beautiful, beautiful picture.
It really is.
Sure. So the lighthouse, as you know, symbolizes where marine vessels, for example, seek direction. And so this was an idea that generated from the nursing shared governance. So it wasn't leadership that had come up with this. So the lighthouse symbolizes that we identify ourselves separate from anyone along the I-95 corridor. And what you see at the lighthouse are the rocks, which are the 12 elements for Pathway to Excellence. So be the light for others to follow, again, just kind of ties it all together. It was an idea that had come up from one of our strategic teams to stand apart from anybody else in the state of Connecticut, because we know that we are the first Pathway to Excellence organization in the state of Connecticut, and we're very proud of that.
That must feel great for the staff as well, not only to be
Sure.
engaged in all these initiatives, but also to have this this emblem, this symbol that they came up with. I mean, talk about engagement and really getting staff to feel good about this. Renee, in the time that you've been here, would you say you've noticed the change in the overall morale of nursing staff at the hospital with all these initiatives now that have been underway?
Absolutely, and the staff want to be more engaged. They get recognized. We have expanded our recognition of the nursing staff for all the things that they do, and we wanted to be the light for others to follow, and they really feel like they are. They're very excited about this, and they're very excited about participating. There was a time where you couldn't get anybody to participate, and now people want to be on these teams and want to be on the councils.
What a great feeling that must be, not to have to beg people to volunteer, but to have an overabundance of
Absolutely.
excited staff who want to be part of this.
And committed.
Yeah.
Now, we talked a little bit about patient safety. Maybe we can go back to that because that has changed a lot of practices as well. Some of one we've already discussed, for example, is that in a safe environment, people speak up when they're uncomfortable. Now, we know that airplanes have crashed because co-pilots have been afraid to tell their pilot that they've run out of fuel. We don't want patients to be hurt because a nurse is afraid to speak up to a doctor and say, you shouldn't be doing that, or why didn't you wash your hand?
Yeah.
So that kind of teamwork. But there are a lot of other things that we've actually implemented, aren't there? And maybe you could discuss a few of those and
Sure.
how we're working
Safety.
both at Norwalk Hospital but across the state to keep people safe.
So you mentioned the first one, which is communication. So within the Department of Nursing, even within the Department of Nursing, from leadership to the frontline staff, we do have huddles daily on the unit with the participation
Tell
of the
people what
staff
that means, because I
nurses.
think that's a great thing. And patients don't see this. A lot of this happens in the background,
Right.
outside of their room. So they don't realize that people are
Actually talking
worrying
about
about
them,
them and
yeah.
talking about them and thinking about what are huddles.
So huddles is the opportunity for the team, whether it be physicians, pharmacists, nurses, nursing assistants, to have a discussion, just a very brief discussion of how's the day going. Are there any patients who are at high risk for anything? Are they going for tests? How are we going to cover a patient assignment if a nurse is off the floor for any point of time? So it's really being transparent in the activity of that particular day, that shift of anything that's of high acuity. So again, it's about communication and making sure that the resources are available for the team that's working on the unit.
And that happens on all the units every day.
Yes.
Every day
Yeah.
and sometimes multiple times. And then we have a higher level huddle where all of the administrative staff in the hospital every
And
day.
clinical leaders, because I know
Clinical
you're there.
leaders,
And they have-
administrative leaders get together to talk about the previous night, if anything, were there any safety issues? Do we anticipate any safety issues? Let's say we find out there is going to be a shortage of a particular medication.
Right.
This way everybody knows, the doctors know,
Right.
and then what are we going to do if we can't get that medication?
Even things like two patients
With
with
the
the
same
names of
last name,
Jones.
yeah.
Absolutely.
Yes.
Or
Right.
sound-alike names are in the
Absolutely.
hospital. We want to make sure, because mistaken
Absolutely.
IDs do happen.
Right,
Yes.
or an environmental issue in the hospital. Any one
If
of
we've
these
had
things
a
will get
leak
brought up.
somewhere, or something's not working, and where are we going to move the patients, and how are we going to handle it? And there's about 50 or 60 people there, and it's just it's a great opportunity to solve problems and to have everybody, the multidisciplinary collaboration to avoid
Yeah.
any patient safety
These
issues.
So if you
Safety
have
huddles.
a toilet that's not flushing, you have the facilities person right there that you can
Absolutely.
say, this room, this isn't working, this needs to be fixed now. And
Because
then
ultimately affects patient care.
that's the whole
That's our
point.
focus.
Right, so these safety huddles have really transformed the way that we deliver care.
Oh, absolutely. And I mean, we have safety huddles when our emergency room gets backed up and we get very busy. How are we going to manage the patients? How are we going to get them in and out of the hospital
Right.
more quickly so that we don't, that we service our patients?
And there are other things like avoiding distractions, avoiding chaos. It's really changing the environment of care. I can go on for this with you
Yes.
for hours, but we've run out of time. We wanted to keep you around for the question, and Vicki and I will be back with our guests to answer this week's health question after these messages.
Stay tuned. This week's health question is really for our guests. Why did you pursue the profession of nursing?
Oh, why did you pursue the profession of nursing?
Well, Vicki and Eric, I don't think I ever wanted to do anything else but be a nurse. Even as a little girl, I love to take care of people. I love to make sure that, as an administrator, that people are cared for in a proper way and that they get the best health care. That's always been the most important thing to me.
How about
Yeah.
you, Joe?
I came from a family of healthcare providers, and I always knew at an early age that I wanted to be a nurse. And I think as my profession has evolved, nurses are everywhere, from schools to academia to at the bedside and in patients' homes. So it's afforded great variability as a profession. It's very
And it's really
rewarding.
changed, hasn't it, over the last couple of
Oh,
decades?
absolutely.
I think I'm so excited about the changes because I think it really delivers better health care.
Right?
And I hate to date myself, but in
I
the
date
early,
myself all the time.
He does.
in my earlier years, you would have patients in the hospital 9-10 days, no
Right.
problem. You got to develop relationships with them. Now
it's fast paced.
Now it's
Sure.
very fast paced. Try to get them in, try to get them out, try to provide all the education that you can in the time in a shorter time frame, and make sure that they can take care of themselves when they leave the organization. So it's and the technology has just grown exponentially.
So it's a
really
really
become a
dynamic
challenge. The
profession.
speed of healthcare and the volume of care, how many more things we can do, but then that
Right.
overloads the system, hasn't it, Joe?
But having to
It
stay
sure
on top
has.
of it also with the education that we talked about before, it really has become much more than delivering patient care at the bedside.
Absolutely.
Yeah.
We only have 30 seconds left, but maybe, do you have any specific moments in your career that you want to share with people at home, that with patients or otherwise? Again, we don't have a lot of time, but
I think my background as a critical care nurse, that you are with those patients at the most vulnerable times, and I miss that. But I know that in the roles that we play now, we are still impacting patient care and making sure that our nurses have what they need to maintain a healthy work environment.
Very well said. I
Yeah.
think that was wonderfully said.
and as someone who's recently interacted as a patient or as a family member with critical care, that environment is so essential to trusting people, and that's all we have time. I'm being told that we've run out of time. So if you at home have a question you'd like to ask Vicki and me on Health Talk, please contact us at healthtalk@norwalkhealth.org.
We would like to thank our guests today, Renee Moriello and Joe Ritchie, and see you next week on Health Talk.
Bye-bye.